Meda Dhatu. Rukti of Meda Dhatu. Medhayati snehayati anena iti medah. Dhatu which lubricates the body is called as Meda Dhatu. It is the unconducted dhatu like a ghee. Fish fat globules which is found around the skin and around every organ is nothing but it is called as Meda Dhatu. One can see the Meda Dhatu during the dissection of the dead body. Synonyms of Meda Dhatu, that is Mausaja and Mausateja. Meda Dhatu is formed from Aharasa after Mausa. Asthikrita. Asthi Dhatu is formed after Meda Dhatu. Fat in omentum and peritoneum. Vasa, fat in Mausa Dhatu. Position and sthanas of Meda Dhatu. It is distributed throughout the body. It is present around every organ and joints. Present in the deep layer, that is the superficial fascia of the skin. Breast, omentum, buttocks and peritoneal cavity are the storehouse of Meda Dhatu. Present around the kidney, called as perinephric fat. Perinephric fat. It is a fat which surrounds the kidney and the adrenal glands. It is a type of visceral fat that is situated with kidney disorders and other diseases like diabetes and hypertension. Perinephric fat secretes the adipokines and inflammatory cytokinins. It regulates the cardiovascular system. It may compress the renal vasculature, which can lead to kidney function disorders. Medova srutas. Medovahanam srutasam vrukkav moolam vapavahanam cha. According to Charak, Medova srutas are vrikka, that is kidneys, and vapavahana, that is peritoneal cavity and omentum. Kidney, that is the vrikka, it consists of blood pressure regulating enzyme known as renin. Renin is an enzyme which is a part of renin-angiotensin aldosterone system that regulates the blood pressure. Renin-angiotensin aldosterone system. It is a normal system that controls the blood pressure and fluid balance and electrolyte levels. Kidneys secrete the renin in respect to blood pressure and volume. Angiotensin 2 is a potent vasoconstrictor that increases the blood pressure. Aldosterone is a hormone produced by adrenal glands that regulates potassium and sodium balance. Overactive of renin-angiotensin aldosterone system can cause hypertension, kidney diseases and heart failure. This picture shows the renin-angiotensin aldosterone enzyme, how it works, how it causes the kidney failure diseases. According to Sushrut, Medova srotas are Medovahe dve tayor moolam kati vrukkav cha. Kati means waist region and vrukka means kidneys. About the constitution of Meda Dhatu. According to Sushrut, Meda Dhatu is predominantly formed of Chala Mahabhut and Prithvi Mahabhut. According to Charak Samhita, Meda Dhatu is predominantly formed of Chala Mahabhut. Medodhara Kala and the Shlok Medaso api yatha sthanaka vasa bahulam tatha api amashaya ekadesha eva. Medodhara Kala is nothing but it is the peritoneal membrane which holds the organs in position. It also holds or stores the fat. Fat which is stored in Medodhara Kala of abdomen udhara is called as visceral fat or belly fat. The picture of belly fat. Properties or the gunas of Meda Dhatu. They are snigdha, unkantak, sthira, stable, guru, heavy, mrudhu, soft, sandra, pichila, viscous. Of Meda Dhatu, sneha, medasaha, shreshtam karma. Medha, sneha, svedho, drudhatvam, pushtima, sthanam cha. Snehana, svedhana, dridhatva and asti poshana. Snehana means to lubricate the body parts. As Meda Dhatu is unconducts, it lubricates the every parts of the body. It also provides softness to all the body. Due to softness, all the body constituents become flexible. The process of formation of sweat is called as Svedhana. Sweat is nothing but svedha, that is the mala, waste product of Meda Dhatu. Sweat is formed in the metabolism of Meda Dhatu. Hence, it controls the formation of sweat. It insulates the body by altering the sweat process. It also maintains the body temperature. Dridhatva means stability. Meda Dhatu minimizes the friction between two constituents by lubricating them. Thus, it makes the body more durable. Asti Poshana, nourishment of Asti Dhatu depends upon the Meda Dhatu, which is often seen in obese patients, also in the diabetic patients. Here is the picture which shows the fat metabolism. Dhatu also acts as a shock absorber and protects the body from trauma. Meda Dhatu also protects the body from excess hot or cold climate. Certain glands which are responsible for the obesity, one of is adrenal gland, responsible for weight gain due to the hormone cortisol, which is released in response to stress. When the cortisol hormone is released in excess, it may lead to increase in appetite, slow metabolism, fat storage, which results in weight gain, particularly in abdomen. Dhatu of Medha, Medasa Snayu Sambhavah. Snayu, ligaments and tendons are the Upadhatu of Medha. Of Meda Dhatu. Svedastu Medasaha Mala. Sveda, that is the sweat, is the waste product of Meda Dhatu. Grains which are kept in water overnight increase in size. In the same way, if the sweat from the body doesn't go out, which is the waste product of Medha, then the person may become obese and face certain problems related to obesity. Hence, it is very important that the sweat, that is the waste product of the meat, should go out of the body. Here is the picture of grains kept overnight in the water. Picture in which the person is sweating. Disorders of Meda Dhatu. There are two disorders of Meda Dhatu: Vriddhi Medha and Meda Kshaya. Meda Vriddhi means it is a disorder in which Meda Dhatu is excess in quantity. Meda Kshaya is the disorder in which the body fat is reduced and person become very thin due to weight loss. There are certain causes of Meda Vriddhi: over intake of sweet, oily and heavy food. Sedentary lifestyle. Medho Vriddhi Lakshanas Tatvena Medhasthata Shramam Alpepi Chestate Shvasam Svikastanu Lambhanam. Symptoms of Medha Vriddhi. Medha, that is the fat tissue, when increases, produces gandha, cervical lymphadentis, granthi, tumor, increase in the size of cheeks, thighs and abdomen, overgrowth of muscles of neck and other places. It causes fatigue, difficulty in breathing even after little work. Drooping of the buttocks, breast and abdomen. The picture of granthi, of gandha, person who has increase in the size of buttocks, thighs, abdomen, of a obese person. Causes of Medha Kshaya. Excess fasting, excess physical exercise, physical, mental stress and also chronic diseases. Chronic diseases such as cancer, stroke, chronic lung disease, Alzheimer's disease, diabetes. Manifestations of Medha Kshaya. Medha Kshaye Pliha Vriddhi, Sandhi Shunyata Roksham, Medhur Mausam Prarthanacha. Medha Kshaya Medasi Swapnam Kantyaha Pliho Vriddhi Krishangataha. Of Medha Kshaya, decrease in the Medha Dhatu, that is the fat tissue, causes loss of sensation in the waist, enlargement of spleen and emaciation of the body. Picture in which there is the enlargement of the spleen and the emaciated body picture.